Hi, my name is SOFIA BINTI HAMSAH, and today I'll be presenting about pulmonology, which is the study of respiration system. This will be my contents: introduction to pulmonology, famous specialists, anatomy of respiratory system, common respiratory disease, diagnostic techniques in pulmonology, and the treatment approaches. Next, I'll be talking about what is pulmonology. Definition for pulmonology is a medical specialty focusing on diseases of the respiratory systems, including lungs, airways, and also the chest. The importance of pulmonology it deals with diagnosis and treatment of conditions like the asthma, COPD, pneumonia, and also lung cancer. So there are two famous pulmonologists. The first one will be Dr. Chevalier Jackson. He is known as the father of bronchoscopy. He developed innovative techniques and also instruments for examining and also treating the airways. He also pioneered methods to remove foreign objects from the respiratory tract safely. His contributions significantly improved pulmonary medicine and also the airway management. The second pulmonologist is Dr. John F. Murray. He is a pioneer in the development of pulmonary function testings and also respiratory care. He co-authored significant studies on lungs, mechanics, and also gas exchange. He played a critical role in advancing modern diagnostic techniques for pulmonary diseases. Next, I'll be talking about the anatomy of respiratory system. The anatomy of respiratory system is divided into two parts, which is upper respiratory tract and also lower respiratory tract. For upper respiratory tract, it includes nasal cavity, pharynx, and also larynx. For nasal cavity, it filters, warms, and also humidifies air and contains smell receptors. For pharynx, it's shaped pathway for air and food, divided into nasopharynx, oropharynx, and also laryngopharynx. For the last one, which is larynx, it's a voice box, prevent food entry into the trachea using the epiglottis. And we move on to the lower respiratory tract. Lower respiratory tract includes trachea, bronchi, and also bronchioles. And next, we move on to the lower respiratory tract. Lower respiratory tract includes trachea, bronchi and bronchioles, lungs, alveoli, and also right lungs. For the first one, which is trachea, it is a wine pipe supported by cartilage rings, divides into bronchi. For bronchi and bronchioles, it conducts air to lungs, bronchioles like cartilage. For the lungs, it divides into two, which is alveoli and also right lung. As alveoli is a tiny sac for gas exchange, oxygen in carbon dioxide. Alveoli is a tiny sac for gas exchange where the oxygen goes in and the carbon dioxide goes out. For the right lungs, which has 3 lobes, and left lungs 2 lobes. Next, we'll be going to the physiology of gas exchange. For the physiology of gas exchange, the gas exchange is the transfer of oxygen, O2, and carbon dioxide, CO2, between the alveoli, blood, and also the tissues. These will be the steps of gas exchange. There are 4 steps. The first one will be the ventilation. The air enters alveoli during inhalation. Second one will be diffusion. The oxygen moves from alveoli, high oxygen, to blood with low oxygen. The carbon dioxide will move from blood, high CO2, to alveoli with low CO2. And the third one will be the transport. Oxygen will bind to hemoglobin with 98% or dissolve in plasma 2%. Carbon dioxide transported as bicarbonate 70% will bound to hemoglobin with 20% or dissolve in 10%. The last one will be the tissue exchange. O2 diffuses into cells and CO2 enters blood for removal. The last one will be the factors affecting gas exchange. There are 4 factors, which is surface area of alveoli, alveolar membrane thickness, and also the partial pressure gradients. The last one will be the ventilation perfusion VQ balance. Next, we move on to the respiratory diseases. Pneumonia is a lung infection that inflames the air sac, which is the alveoli, in one or both lungs, potentially causing them to fill with fluid or pus. This condition can result from various causes, including bacteria, viruses, fungi, or even chemical irritants. The second one will be COPD. COPD is a chronic obstructive pulmonary disease. It's an ongoing lung condition caused by damage to the lungs. The damage results in swelling and also irritation and inside the airways that limit airflow into and out of the lungs. This limited airflow is known as obstruction. Symptoms include trouble breathing, a daily cough that brings up mucus, and a tight, whistling sound in the lungs called wheezing. Third one will be tuberculosis. Tuberculosis TB is known as to be an infectious and fatal condition that is caused by bacteria called Mycobacteria tuberculosis, which affects the lungs. Since it is infectious, it often leads to other health complications because the persons infected with tuberculosis have a very low immunity. So we move on to the next one, which is diagnostic technique in pulmonology. The first one will be the pulmonary function test. It's a group of non-invasive tests that measure lung function. These tests assess how well the lungs take in the air and transfer oxygen into our blood and expel carbon dioxide. The next one will be bronchoscopy. Bronchoscopy is a diagnostic and therapeutic procedure that allows doctors to examine the airways, trachea, bronchi, and also bronchioles using a thin, flexible or rigid tube called a bronchoscope equipped with light and also camera. 2 treatment approaches, which is the first one is bilateral positive airway pressure BPAP and medications for bronchiectasis. It includes antibiotics to fight infections or inhale corticosteroids or expectorants or even bronchodilators. So I think that is all from me. Thank you.